orthopedics, sports medicine, and primary care. Join us here for your prescription to better health. And we're live. Hello, South Florida and beyond. Welcome to the How to Stay Healthy show here on Friday. We're already getting alerts there as you can hear the ambient noise. We got a really action-packed program tonight. We have Dr. Bella Kovacs, an internist, internal medicine, from Fort Lauderdale, made the drive over. How was the drive today? Was it, there didn't seem to be a lot of traffic, so.
Interesting. It was an interesting drive.
Doctor, just pull that mic up a little closer to your mouth there. There you go. Perfect. Yeah, sometimes, there's a lot of traffic and sometimes there's not. So I'm glad you made it over and thanks for coming early. We have a lot to talk about today. You're an internist, so that's internal medicine, but one of your specialties is hyperbaric oxygen chamber.
Correct.
And I got to tell you, I don't know much about it. The only thing I know is I'm thinking when divers get the bends, but that's something else, I think.
No, that's exactly.
No, that is what it is?
That's where it comes from.
Okay.
The Navy developed it, and then Wound Care took over, and they are using it all over the world.
Okay, so you have been involved. It's the Wound Healing Institute at Florida Medical Center where there's this hyperbaric oxygen chamber. How long have you been involved with that program?
Over 15 years.
Wow, I didn't realize they had that there for the last 15 years.
They were the first one in Fort Lauderdale, in a hospital setting.
In a hospital setting. And obviously wound healing, is that what it's mostly for? Or tell us a little bit about what the hyperbaric oxygen chamber is used for.
Yes, to answer your question, 85% of our patients are diabetic foot ulcer patients. The way it started is obviously with the Navy and with the bends. And what the hyperbaric chamber does in very simple terms is it puts a higher concentration of oxygen in your bloodstream. Now imagine a diabetic patient who has problem with the circulation in the feet and in the legs. That's very common among diabetics. Let's suppose that patient develops an ulcer that gets infected. To fight the infection and to heal that ulcer, that sore, takes a lot of oxygen.
Of course, yeah.
Let's suppose the patient simply cannot put enough oxygen into the bloodstream and carry it to that area because of the problem with the circulation. Then you have basically two choices to help. One would be to improve the circulation, and that's what a vascular surgeon does. Either they put in a stent to open up that blood vessel and carry more blood there, or they put in a bypass that is giving extra blood flow through that bypass to that distal area. What we do in hyperbaric is we simply put oxygen in a higher concentration into the bloodstream.
More than normal.
Double, triple. Instead of improving the blood circulation. It's like your coffee. You can put a lot more sugar in 1 cup of coffee. If you want more sugar, you don't have to drink 20 coffees with a little bit of sugar in each. You can drink 1 cup of coffee with 20 times more sugar. And that's basically what hyperbaric is about with oxygen.
Thanks for explaining it that way, because I understand it a little better that way with the coffee example. But listeners will be surprised to know that, I cut sugar out of my coffee. I'm just drinking it with just milk. It was hard to do at first, but you know what? Now I enjoy the taste of it with milk. So, it's
You're
better
becoming
that
an
way.
Englishman now.
Yeah, an Englishman. There you go. If you have any questions, we're here with Dr. Bella Kovacs, internist. And like he was just telling us, Wound Healing Institute at Florida Medical Center and the hyperbaric oxygen chamber. If you have any questions, you can call us at 1-888-565-1470. And we'll see if we can get you on the air with Dr. Kovacs. Now, let's talk a little bit what's really lately in the news. I got to ask you, you're an internist. Has this flu one of the worst flu seasons you've seen in the last decade, or what's going on?
I would like to answer it in two different ways. When I read the CDC accounts of it, when I get the emails from Tallahassee, from the medical board, supposedly this is a very serious one. and it is more serious than the recent ones have been. My personal experience is that it's about the same. In medicine, you call a small number of patients an anecdotal evidence. I do not have enough patients, thousands of patients with the flu, so that I could set up statistics. So my experience is probably luckier than the average experience. Just today I got in from
This is hot
Tallahassee.
off the press from Tallahassee.
This is just
This
out
is the
of-
Florida Health.
And they are
report.
yes, and they are saying that the recent experiences that this is much worse than previous ones a couple of years ago or since then, and they are recommending that people take it seriously. Go to your doctor. That's what I would recommend. Go to the emergency room if you have to. Supposedly the emergency rooms are full of flu patients. Now, obviously, patients who are old, who are weak, who are on chemotherapy, who receive steroids for bronchial asthma or rheumatoid arthritis or something similar, patients who have emphysema, chronic bronchitis, these two are called COPD, chronic obstructive pulmonary disease. These are the patients for whom the flu is the most dangerous. These are the patients who probably would be admitted to the hospital for a couple of days and not just discharged from the emergency room on some medications.
Wow, that is serious. So is it too late to get a flu shot, or is
Nope,
it still?
never too late.
And what will that do? I've heard up to 30%. It could lessen maybe the symptoms by 30% if you were to catch the flu, I've heard. But I know that's ever changing in all these reports
It is
you get.
always changing. I have read articles that said that the present flu shot is not exactly produced for the particular type of virus or viruses that are causing the problem this year. It doesn't mean it doesn't work. It just means that it is not as effective. Probably fewer people are protected. I don't have personal knowledge and experience on this one. All I can say is what I quote from articles.
Well, we appreciate, giving us any info, because to have an internist right here in the studio as people are driving around their cars or listening online. I know we got some viewers on Facebook Live. Isn't that amazing? I mean, it's global now. And you said, is it your son listening in London?
In London, yes.
We'll say hello to him.
Michael, how you doing? He was born in Plantation, my daughter as well. Both of them went to Pinecrest, and they both of them went to University of Pennsylvania. And my daughter is in the Air Force in military intelligence. And my son is in London, and together with another person, they own their commercial real estate company.
Fantastic. Well, sounds like you have great kids, and also thank you to your daughter for her service.
Thank you
It's very
very much.
important. We appreciate her protecting the freedoms. Now, I wanted to ask you a little bit about, because I don't know if, try not to shake your hand when you walked in, but I don't know if you could tell I got a little something going. I've had that, my wife had upper respiratory infection, then I caught it, then my baby daughter had a little something, and then I went around the office I work in, and that was like early December. Then I got it again around Christmas, and then it got better again. I got my flu shot right away, but I got another little thing I was reading today about the adrenovirus. I don't know if I'm saying that right.
Adenovirus?
Yeah, adenovirus. Thank you for... Now, are there flu symptoms that we should
all of them.
look for?
All of them causing the same thing. It's,
And what are those symptoms?
You start feeling uncomfortable, your skin becomes sensitive, you feel a little cold, that you are in a cold environment because your body is trying to increase your temperature. By the way, it's a very interesting thing. Viruses, bacteria, all these germs, they love a particular temperature, and many times it is the temperature of the normal human body, 98.6. So one of the ways the body fights them is it increases the temperature. That's why we have a fever. They don't like the higher temperature, these germs. So this is just one way the body does it. So then you start having shivering or shaking chills. But usually with viruses, you don't have shaking chills. It's usually bacterial infections that cause that. And then people start having sore throat, they lose their voice, they are hoarse, they have a dry cough usually, not a moist cough. and it's just a dry, hacking, annoying cough with itching in the throat, nasal voice, and then probably some nasal discharge. And then they come to me. And then I ask, which one do you want me to help you with? And there are over-the-counter medications. Obviously, there are prescription medications, and some people go to the doctor in time, others wait a long time. I just discharged a patient from one of the hospitals who came in exactly the right time with a COPD, an elderly lady, very frail, very slim, and with the pulmonary consultant's help, she was discharged today after just 4 or 5 days.
Nice.
Went back to the
Probably
assisted
saved her
living
life.
facility. I think the pulmonary doctor did, yes. I would like to give him the credit.
Wow, well, mention the name if you'd like.
I can't.
Oh, okay. That's fine. Well, we thank you for, seeing that patient and, able to get them on the path to recovery because as we've been reading and seeing in the news, a lot of very young people are dying from the flu and, of course, elderly population as well. We're here with Dr. Bela Kovacs, internist. I want to give out your info. Correct me if I'm wrong, but it's 2951 Northwest 49th Avenue.
Yes, it's a central building next to Florida Medical Center. I have been there since November 1980.
Whoa! Wow! I'm trying to.
I guess it gives away my
years?
age. Yeah, it gives away my age.
Yeah, but
yes.
you look great, and John and I were just talking to you in the studio. We got a lot of viewers on Facebook Live, so ask me questions there if you'd like. I'll get them to the doctor. We have them for another good 20 minutes. But you look great. John Kelly from All County Healthcare, who sponsors this show, and I were talking with you in the green room there, and you were telling us that you run and bicycle and
that's correct.
Stay in shape.
That's what I try to do because my patients ask me, what do you do? When I recommend that they exercise. I was 5 years old, went to a summer camp, and I won the 50-yard dash, and I was sold on running, so I have been running ever since. I just usually run 5K practices during the week, twice, and then usually go for a race on the weekend. So tomorrow morning there is a race at the Blanche Ely High School area.
In
Pompano,
Beach?
yes.
Pompano Beach, okay.
On Atlantic and...
not far from here.
And 95, yes. And it's for a very good cause, for a good teacher. That's how I understand it is for. And it's a 5K race, and there's a community of those who run, and we kind of use it as a social occasion as well. And then March 11th, there is the first race of the duathlon season on A1A from Las Olas. And it's a 1 mile run, 10 or 11 mile bike, and another 3 mile run. And that's fun. I'd love to do triathlon, but I'm not a very good swimmer.
No, okay.
So I just do the
run and the bicycle. Run is really neat.
Yeah.
That is really neat. And it's a great thing you're doing to help out a cause for is a teacher, you said, for
That's
tomorrow.
That's my understanding, yes.
Again, we're here with Dr. Bela Kovacs, internist. I was giving out your address before, 2951 Northwest 49th Avenue, Suite 307 in Fort Lauderdale. Number's 954-484-1111. And right next to Florida Medical Center, where you've been on staff at that hospital for, I guess, since 1980 as well?
1980, yes.
Wow, fantastic. Tell me a little bit about the hospital. I mean, it's gone through a lot of changes lately, and I'm seeing a lot of renovations going on and whatnot.
Yes. It's very interesting because when I came here in 1980, the area was a retired community. So the hospital, that's one of the reasons why the hospital became a heart hospital, because my average patient was 74 years old at the time. They were usually retired people from New York City.
Oh, yeah.
And by now, the demographics have changed. So it's much more diverse population, and it's much more diverse in age. My average patient now is about 40.
Unbelievable.
So I accept patients starting around 16 or 17 because I don't have nearly as much experience with children as I have with adults. The illnesses are very different, so Florida Medical Center is adjusting to the new requirements, and the surgeons with the robotic surgery and...
the Da Vinci, right?
Yes.
I actually test drove one this week.
Oh, really?
At Good Samaritan Medical Center in West Palm Beach.
Doesn't it feel like that you are in the movie Aliens?
It's amazing.
And you are moving around with that thing, and it gives you a magnification, so you see everything in front of you. When I came to the United States in 1975, and I had to obviously take my equivalency test, I worked at Hollywood Memorial for 5 months as a surgical assistant. So I enjoyed it immensely. But when I think back what surgery was at that time and what surgery is today, the world has changed a lot, and it has improved a lot, and it is much more precise, and the things that they can do today those were never even imagined 35 or 40 years ago.
Dr. Kovacs, hold that thought, and on the other side, I'm going to ask you a little bit about what other things an internist looks for, like cardiovascular disease, cholesterol, and hypertension and obesity on the How to Stay Healthy show. But we're going to wait a second there. I'm going to blow right through the break. I'm going to blow right through the break. That's all right. So let's talk about it now. You're, as an internist, also look for signs of cardiovascular disease in patients.
Absolutely,
that's something that's like...
I'm in the trenches. I'm the first line. I'm the first line. The cardiologist comes usually after that, when we find something wrong with the patient, or we suspect there may be something wrong with the patient, or we think that the symptoms of the patient, may I just explain, symptom is what the patient notices and tells us, and a sign is what we notice or what we find. The symptoms of the patient tell us that we should be looking for heart problem, but let's suppose the cardiogram and the chest x-ray don't show anything. They don't answer my question, what is causing those symptoms. In that case, I would also ask the cardiologist to go and investigate the patient further, for example, with a stress test or an echocardiogram. So we are really the first line. And I think it's a very important aspect of medicine, because there's only one heart. When that heart stops, everything else stops, and there is no reason for that heart stops most of the for that heart stopping most of the time. And we would like to postpone that event. Eventually, we will all crash and burn. There's no question about it. But it makes a difference when it happens, and that's our job as primary care physicians, PCP, to look for those problems that could shorten the lifespan, and find them, and then look for correction.
When you have the stethoscope and you're listening to the chest, you're listening for things like atrial fibrillation and other heart murmurs, different ticks. Yes. That's what's going on at that point?
Yes.
And that's pretty much at every checkup there.
Oh, yeah. I enjoy putting my hands on the patient and examining the patient, because when I was a very young doctor, I was my chief of staff. The first place where I worked was an older gentleman who was in a prisoner of war camp in the Soviet Union after World War II. And obviously the Soviet Union didn't have any X-ray machines and medications and diagnostic equipment even for their own citizens. So the prisoners of war got even less than that. So he had to learn how to examine the patients, and he knew it better than any chest X-ray can show you how large the heart was and what configuration the heart showed, and that's what he taught us right from the beginning. So I was very fortunate to have a boss like that.
And he didn't have the tools that other doctors around the world may have had, especially in the U.S.
And today you can't even imagine not having imaging studies.
He was using his senses, his eyes, his ears, his nose.
His fingers.
Yeah.
They say that all doctors who percuss you on the chest, for example, they don't even need their hearing, because they feel the resonance in their left third finger. If you are right-handed, you use the left third finger for that, and vice versa. And we would feel the resonance. We don't even hear the sound, because we are so used to it already, because we have examined so many patients.
Unbelievable. Now, an internist can also help with preventative medicine, ways to maybe ward off cardiovascular disease or other ailments. They can talk to you about life changes, eating better, losing weight kind of thing. Can you talk a little bit about preventative medicine?
Yes. Let me talk about the positive things first. Obviously, when a patient comes to the office for the first time, unless the patient has had some recent lab studies done, then we would just check for certain things. If you discover diabetes that the patient didn't know about, you can save many healthy years for that patient because the long-term complications of the diabetes are obviously dangerous. The brain, the eyes, the heart, the carotid arteries, the kidneys, and the circulation in the legs. You can slow down the development of problems there. Cholesterol is the same thing. You check the cholesterol. Very interesting how it changed what we accept as normal cholesterol. By the way, if I may tell you this little story, I went to a medical lecture by a professor of endocrinology who was teaching in Jacksonville, I remember. And I posed the question at the end of his presentation saying, well, if the cholesterol is so bad for us, why is there any cholesterol in our body? Is there any number that is low enough for the experts to accept that it should be in the body? And he said, I really honestly cannot answer that question. But if you go into a maternity ward and the baby just pops out of the mother's womb, you stick the finger and check the bad cholesterol, the LDL, it will be 30. So I would say that that is probably the best LDL, the best bad cholesterol level. I have not seen anybody with an LDL of 30.
No.
I'm taking medication myself for cholesterol. Mine is somewhere about 60, 70. And my doctor is happy with it. I don't doctor myself, so I go to my medical doctor. I will be there next week, yes.
Nice.
And that would be the cholesterol. High blood pressure is another thing. To think about what high blood pressure, the easy way is, the blood pressure is the resistance against which the heart has to pump the blood. So if there is lower resistance, it's easier for the heart. It doesn't get tired so easily and so soon. If the pressure goes up, the heart has to work much harder, so it gets tired sooner. The brain actually likes higher blood pressure. It's very selfish. But we should not allow that because that's how stroke happens. That's one of the ways how stroke happens. So the limit, the normal limit is changing. The most recent recommendations, which are not official yet as far as I know, go as low as 130/80.
Whoa.
We normally accept it 150/90. But the lower, the better, obviously. There's a lowest limit, obviously, because the kidneys need a certain pressure to produce urine. So if you go below that pressure, the kidneys stop working, so obviously it would not be good for you.
Oh, and they don't have enough pressure to push out the urine.
And that number would be 80.
Oh, wow. I never knew that. I'm learning so much today having you on the program. I've had internists on before, but I think your experience, just speaks for itself. So
thank you.
I'm really happy that
You're spoiling
the drive.
Thank you.
You're always welcome, though, on the show. I actually have a Tuesday night show, too, 6 to 7. I'll give myself a shout-out. It's called the You and Your Doctor Show. And I normally split it into two segments, 6 to 6:30 and 6:30 to 7. Same thing, we have endocrinologists on, internists, cardiac surgeons, cardiologists. We've had an interventional neurologist on the program, a neurologist, a lot of orthopedic surgeons. And last week, we had a nephrologist, and we talked a lot about diabetes and kidney care, and it was an amazing show. So I want to thank you for coming on this program, but we're not done yet. We're going to talk a little bit more. You told me what age range of patients you see in the office. Now, do you also talk to men and women differently about their health? What I'm saying is I see areas of interest sometimes on internists' rack cards that says women's health or men's health. Are you able to differentiate the two, or are you just talking adult health in general?
Both. There are common problems or the type of...
We have 2 minutes.
There are problems that are common for both groups, And then there are separate problems, obviously. I don't usually have to talk to men about mammography, although I have seen 2 or 3 patients in my life who had breast cancer.
Wow.
And supposedly breast cancer for men is very dangerous and probably more dangerous than for a woman. And obviously I don't have to send them to a gynecologist. Then on the other hand, colonoscopy is recommended for people over the age of 50 every 3 to 5 years or so, and that applies to both of them. If I find a 25-year-old woman who is iron deficient, I would bet 100 to 1 that it is due to periods and to blood loss during the period and childbirth. If I find a woman who is 70 and iron deficient, then I would probably recommend the same thing that I would recommend to every man of any age who is iron deficient, which is to go to a gastroenterologist and have the stomach and the large bowel examined for any bleeding lesion. So there are these age differences and there are these gender or sex differences, yes.
Well, it's hard to believe we've talked for 30 minutes. You're always welcome back on the program. I do have a little less than a minute, so I'm going to give out your info. Again, it's Dr. Bela Kovacs, Internal Medicine, 2951 Northwest 49th Avenue, Suite 307, Fort Lauderdale, 954-484-1111. On staff at, Florida Medical Center, campus in North Shore, located in Fort Lauderdale. Thank you for coming on the program.
I appreciate it. Thank you very much. It was a lot of fun.
Have a good run tomorrow morning, and we'll see you next time on the How to Stay Healthy show.
I will do it for you tomorrow.
Awesome.
Thank you very much.
For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.